Okay. I hope everyone had a chance to get to know their neighbors a bit and build a bit of community. Um, it wasn't the ideal place for it, but it's all good. We'll roll with it. So thanks everyone for choosing to attend this session, and evidently it's a choice towards your own mental health and wellness. Today we'll be talking about navigating IBD and mental health, and just a bit about how I came to present here today. Terry, or Susan's in the room. I'm someone who lives with IBD. I have Crohn's disease, and I'll talk to you about it in a bit. But we were just in a conversation, and they said, wow, you have so many letters behind your name. How did you get there? And so I'll talk a bit about that. But I'm not a medical doctor, but I do have my PhD, and I'm a registered psychologist. Currently, I'm an assistant professor teaching with the School in Applied Child Psychology program at UBC. I just started in July, so I'm excited to be here and to share kind of my own experiences and hopefully help you along your journey or supporting someone along their own journey. Okay. There's the disclaimer. I'm not sure, I missed the beginning, but I don't know if a land acknowledgement was done. Was it? Good. I also personally would like to just acknowledge that we're on the unceded traditional and ancestral territory of the Kakite people, and it's important that we do this when we gather, also to make it meaningful and personally meaningful, and I like to do a little research about it before I get started. So if you don't know, the Kakite First Nation was actually founded fairly recently by a person named Rhonda Larrabee, who actually lived a long time in Chinatown in Vancouver thinking she was Chinese. And she was later told by her mother, actually, you're not Chinese, you're First Nation. And she made a really cool documentary called A Tribe of One, and how she started the New Westminster First Nation band, the Kakite First Nation. So something to look into. I happen to live in New Westminster as well, so I acknowledge that I live on this land as well. Yeah. Okay. So a lot about this talk is kind of be a bit about me. I'm just going to be a bit selfish and just talk about myself for a bit. And you'll understand why, I hope. And then we'll talk about IBD and mental health, which I think a lot of you probably understand a lot. And we'll talk about maybe the patient-caregiver experience, a patient and caregiver experience, just to bring awareness from either side, depending on where you're at. We'll talk a bit about finding and providing supports. This is not going to be the be-all and end-all. It's just the start of the conversation, and maybe give you some avenues, maybe something you haven't heard before. But navigating mental health, we're going to need a whole day to do that. So your whole lifetime to do that. And we'll talk a bit about building resilience, specifically related to inflammatory bowel disease. And then I don't know if we'll have time for questions and answers, but I'll be at my booth if you do want to come chat with me, and I'll share my contact information at the end. Okay. My timing is all thrown off, so bear with me. Okay. So, as I mentioned, I'm Simon. I am a psychologist. I just finished my degree 2 years ago. And registered as a psychologist. It's a long journey to be a psychologist. It's like 7 years of education. On top of that, I was previously a teacher, a high school teacher. I taught out in the Yukon. And I'm also a parent of 2 kids. That's them during the pandemic out at a park, eating their snacks. And I also live with Crohn's disease. And so I think the picture of it and the message I want to communicate for those of you with Crohn's disease or colitis or inflammatory bowel disease is that, on the surface, I guess I'm pretty successful. I guess I've been able to get through school, and it's possible. You've got to make some tough life choices along the way, but it is possible. So a bit about my journey, and you all have interesting, fascinating journeys, and I wish we could have more time to share your own journeys. But I hope maybe you'll resonate with some of the things that I went through. So I was undiagnosed with early symptoms, probably for many of you, like since I can remember, I've had some kind of symptoms of Crohn's disease, whether it was pain in my stomach or, feeling butterflies in my stomach, or the way that it presented for me was I had a lot of canker sores, so like mouth ulcers. And for the longest time, my doctor, I went to specialists. I remember being a kid, like 12 years old, and we were at Vancouver General, and the doctor was bringing in all his colleagues. Come look at this guy's sores. Come look at this guy's sores. I remember I had like 10 different doctors around my mouth looking at how big my mouth ulcers were. And I was a kid. I was like, I didn't know what was happening. But that certainly didn't imbue a sense of confidence that they knew what they were doing when they're like, oh, come look at this. This is the worst I've ever seen it. Anyways, I'm not here to rag on doctors. It was just a journey. And so it was a long journey, and I put the stages of grief, not that I'm saying that, I was dealing with death or anything like that, but being diagnosed, you kind of go through stages. It's a loss of the life that you thought you planned out for yourself, right? And you kind of have to go through the stages of denial, anger, bargaining, depression, and then I'm kind of at a place where I've accepted it. And I think from that, you can do a lot. But it's certainly not a linear journey, and reality is messy, and my journey was certainly messy. I didn't get diagnosed. I was telling you I had symptoms since I was maybe 10. And so for 10 years, I wasn't diagnosed till I was 19 with Crohn's disease. And even then, at the time, you heard today, IBD presents from mouth to butt, or what was the term? What's it? Gums to bum. That sounds better. That wasn't that. They didn't know that back then, and that was only what? I'm not going to give away my age now. I can give away 20 years ago, and they didn't know that, right? So I had a GI who absolutely refused to acknowledge. I had to see a mouth doctor and a GI, and the GI would not acknowledge that it was anything related. And I had to go on that journey of figuring out that diagnosis, making that tough choice of, we'll talk about it later, but if a therapist or a psychologist or a counselor is not fitting with you, it's okay to take that action and to seek a second opinion. So I did that, and that led me down a totally different journey. There's also that denial. When I was first diagnosed, I was having symptoms. One thing with mouth ulcers, it's not a good idea to, so whenever I would start to get symptoms, I'd be like, I know I'm not going to be able to eat for the next month, or at least what I wanted to. So the first thing I would do as a kid, as a naive kid, I'd be like, I'm going to go get a Slurpee and I'm going to go buy some chips. And so obviously that's not a wise choice to numb your mouth and then to eat, something super sharp. But I was young and naive, and I did anyways. Throughout my life, I went to university. I initially, I did a genetics degree. I didn't want to be in a lab all day. Then I did a teaching degree, and during that teaching degree is when my symptoms really flared up, and we started to see the connection. I was in hospital for over a month, and not eating for a month, so I had that, tube that went all the way to your heart, and they called it the golden serum, so basically I was being fed through the IV bag. If you haven't experienced it, I don't wish it upon you. And this is not to say that to scare anyone. This is just, part of my journey. And, I kind of take it as a positive. I'm not saying it was a positive, but it was a time for me to reflect on what, when you go through these big changes in your life, these diagnoses, it forces you to reflect on your life. It forces you to think about what's important to you. And well, that instance, when I was in teacher ed, that made me decide, my wife was my partner, my girlfriend at the time was there. She took off time from her degree. She came to support me. And, that's after that period, I asked her to marry me. And that was a big life decision. And during that teaching degree, I ended up going off to the Yukon after that and teaching there. And then after that, after 2 years, that early phase of early diagnosis and trying lots of different medications, that's probably the toughest time. And so going to a new province and dealing with the stressors of that, I was told when I was doing my teacher ed, oh, this program's too difficult for you. You're probably undergoing too much stress. And that was probably the worst thing that someone could say to me, because it wasn't that the program was stressful, is that I had a whole bunch of other things that were going on, right? And it's not for other people to say what stressors are causing you to have symptoms. It's just part of that journey. And part of me understanding, accepting that, obviously stress impacts me, but it wasn't one particular thing. That you all are managing your own life stressors, and it's up for you to decide what and how to manage all of them, find balance in your life. So, as I mentioned, there was another period where I was hospitalized, and that really led me to reevaluate, can I be in a classroom for 8 hours a day and be consistent and be available and present for my students with all these disruptions. So I had to make a tough life choice to make a change in career. I pivoted to psychology, and then 7 years later, here I am. So my current position allows me a lot of flexibility with my work, but actually I'm happy to report I'm majority symptom-free. I've had that pyramid of treatments, I've had all of them. I've had 2 resections, about 30 centimeters, 15 each time, and I'm on Stelara to manage my condition, and I self-inject every 8 weeks, and I found balance that way. Another thing that I did that found was just being open to supports. What you'll find I'll talk about today is there's a multitude of mental health supports that are out there. And really it's about the time in your life and when you're ready for it. And when I was going through my psychology training, I was open to it. I was trying to understand how mental health is connected with IBD and just to try to find what worked for me. And I was at a conference, a brain and development conference, and I was meeting with this a very famous author, if you know him, Dan Siegel, who wrote the book, The Whole Brain Child, and I was telling him about my Crohn's disease, and he said, oh, actually, there's these really cool people, Patricia Gerbarg and Richard Brown, who are doing mindfulness training to support people with trauma and also with recurrent health disorders. The next week, I was on a plane to New York, and I went to a mindfulness retreat, and that was pretty life-changing as well. And it's something I still do today. It's part of my own self-awareness. When I do see a flare coming up, is I will do mindfulness practices. So, I know it sounds a bit out there, but there is a lot of research coming out of the effectiveness of mindfulness for changing your brain and also changing your body. So you can even do it to self-hypnotize yourself, and it makes the pain go away. It's pretty amazing. So when I was at probably a 10-point pain scale level, I could go into a self-meditative state and I could numb out the pain. But I'm not here to give medical advice, just that's worked for me. So I wanted to share that. Okay. So at this point, this is what I wanted you to share after I shared, but that's okay. You guys have already shared, so thank you for doing that. And the important part of that is just to help build community, because the people that are around you, these are people that you'll go on to meet and rely on in different ways. I'm looking at Natalie over here and Haley over there, who I've had the unique opportunity to work with them for different projects. And we started a conference together called the Invisible Conditions Conference, and that was really meaningful for me, and I learned a lot from that process. And kind of my involvement with Crohn's and Colitis of Canada has been in and out, right? Just we're at different stages of my life, and I encourage all of you to be involved and bring meaning to your own life. And obviously you've came here, so you're finding meaning in that way. And so to be involved in small ways can be meaningful. All right, let's get to the actual topic of today. So this is from the impact report that was put out by Crohn's and Colitis of Canada. I just wanted to give some background here. 21% of people diagnosed with IBD, particular children and adolescents, have been also diagnosed with clinical anxiety. To contrast that, in the general population, it's about, I don't have my notes because we're doing it this way, but it's about 1.5 to 2 times as much as the general population. Same thing with depression. Depression's about, in the general population, it's about 7 to 8%. And for people with IBD, it's 15%. So the presentation of anxiety and depression is much more. All right. So why is this? Well, there is emerging research, and you guys have heard it, about the brain-gut connection. Interestingly, I can't go fully into this, but it's estimated that 90% of your body's serotonin. So serotonin, I don't know if you know, is kind of our happy endorphin that makes us, that's connected with depression and anxiety. And if 90% of it's created by our gut, that's emerging research out of mice models, then does it not make sense that what happens in our gut is going to impact our brain, and then vice versa, right? So I think the evidence is still coming out, but it's pretty unilateral that what happens in our gut is impacting, and that's probably causing the higher rates of clinical diagnoses. So it's obvious, I'd like to deny it when I was younger and I was in genetics and very scientifically minded, and I didn't want to believe that stress or negative emotions or lack of sleep can disrupt your gut. But there is tangible evidence that there is. Inflammation and infections can affect that communication. And when disrupted, the gut can amplify some of the anxiety or depression that you're already feeling through some of these chemical communications that are happening between. But there are interventions. So if we can have interventions for the gut to help your brain health, then certainly evidence-based treatments for your brain, your well-being, can also impact your gut. So interventions like cognitive behavioral therapy, specific medications can help you enhance and recalibrate that connection. Okay, so part of it starts with awareness. So I'd like to just give a brief overview on what anxiety looks like. A good question this morning was, well, what happened? Like, how do I know when to get help? We know that anxiety is very prevalent, and it comes up probably stronger when we have flare-ups or IBD symptoms. And anxiety can look like restlessness, fatigue, being tired, excessive anxiety or worry, like worrying about the future, increased muscle aches or soreness or complaints. We call them somatic complaints, so worrying about your body, feeling pains in your stomach. Is it the IBD or is it anxiety? Impaired concentration, irritability, difficulty sleeping. So the important thing to note with this is that we all have some level of anxiety, of stress. At what point does it become a clinical significant. It's really when you want to ask yourself is when it's impacting your daily functioning or your work, right? Is it significantly impacting you for a long period of time? Then the first step is to recognize that, or to help someone recognize that, and to seek help. Depression, very similar. The distinction between, anxiety and depression is that depressed individuals may feel more stagnant and pessimistic, whereas people with anxiety will feel more agitated or future focused, right? And people with depression often will talk about lack of motivation. And I think, I certainly went through it of just feeling hopeless. What is my life going to be like if I'm just in the hospital all day, or if I'm in the bathroom all the time, or is anyone wanting to be around me when I'm like that? And you kind of lose that sense of hope. Changes in appetite, difficulty sleeping, agitation, fatigue, difficulty concentrating. You see how it's very similar to the anxiety symptoms. But the treatments are very different, and the experience of it is very different. All right. I think it's important to recognize, the experience and perspectives of patients and caregivers. This certainly won't capture everything, but we know that there's physiological challenges like diarrhea, cramping, abdominal pain, weight loss, fatigue, psychological increased poor self-concept or depression, lack of hope, social isolation. The more you feel like a burden on others, the more you withdraw inwards, right? And educational, the number of times, like I mentioned, it impacted my educational decisions. Difficulty to tell your teacher or tell your professor that you have Crohn's disease when you don't know when it is or isn't going to impact you, and the inadequate accommodations. But together, I think the running theme, and a lot of people I talked to this morning, the biggest challenge, the biggest stressor on our lives is the uncertainty of how this is going to impact you, the uncertainty of when a flare-up's going to happen. I wish we could just say, oh yeah, just avoid, don't be stressed. Well, that's not really that's what my parents always just don't stress. It's like, well, that's not how we manage anxiety, and actually being resilient and overcoming anxiety and overcoming stress actually helps you through that. So managing a low level of stress is actually, and big stressors even. I think all of you in this room, if you've experienced Crohn's or you're helping someone through it, you've gone through those flare-ups. And if anything, those are making you stronger, getting through those. That's our treatment for anxiety is exposure therapy. So if someone is anxious, often it's because we've overprotected them and we don't expose kids to the challenges. And that's commonly associated as overbearing parents who are over-involved, and a part of our treatment is having that parent step back and helping the child overcome that in small steps. So your flare-ups, whether you realize it or not, is some form of resilience boosting. And if you can overcome those periods, you're strengthening yourself through gaining supports, through building self-awareness, and just through problem solving and recognizing how that's affecting you. And we adjust. We constantly adjust. For caregivers, I know a lot of caregivers are in the room. There's a lot of burden on you, right? And I know you're being supportive, but there's high levels of anxiety and depression in caregivers. You're often doing the worrying about treatment, surgery, future life, finances, and side effects. I remember when I went through it, I said, I don't want to know about the side effects. I told my partner, you figure out what all the bad things are that's going to happen to me, and you just make sure I don't do those things. I'm just going to worry about things I can control, right? So it's important to overcome these things that you focus on what you can do. And that if we get stuck in this cycle of worrying about all the things we can't control, that's when you're going to be going down that negative path. Obviously, there's financial concerns. Thankfully, there's a lot of, we live in Canada and there's lots of coverage. I know my medication, I looked at the bill, it's $5,000 every injection. So I'm thankful to the pharmaceutical companies for having compassionate care. But there's expenses, and your family income and things like that. Quality of life disruptions, care responsibility, going back and forth to appointments. And obviously you have other kids, you may have other kids as well that you're caring for, and that can be a stressor. Balancing life, thinking about burnout, and in your own mental. It's important for you to take care of yourself first so that you can take care of someone else, right? That's just basic first aid, right? Take care of yourself before you can take care of other people. And it's hard to give yourself permission when you care so much about the person that's going through some of these really challenging things. So ways to support. This is actually from the Crohn's and Colitis Foundation in the US. You can give tangible support by just basic things like giving a meal, providing transportation, offering to watch child or pet, emotional support. Don't take for granted how much this can mean for someone just by listening to their experience, sending them a note, giving them words of affirmation. Just little things. You got this. You can get through this. We're here for you. Informational support, right? I think you're all here, so you're doing this. But letting them know about the positive things that Dr. Sly was talking about, that there are research and things. Give people hope. We need to see hope. So that's why I think this conference is really great. Let them know about local support groups. All right, so I did want to give you one snippet. I don't have a lot of time to walk you through this, but there are resources. This is from Dr. Ross Green and his previous colleague, Stuart Ablon, but they developed this cloud of proactive solutions. And so when there are problems, this is for the caregivers, but I think it's useful for anyone. You can solve the problem unilaterally, which is like my way or the highway. You go to school or you don't, or this is the consequence. You solve the problem collaboratively, as plan B, is you sit down with that person, you listen to their concerns, and you collaboratively develop a solution, which I'll talk to you about in a bit. Or you let it go. You pick your battles, right? As parents, as caregivers, you understand. You can't solve all the problems all the time. Sometimes you're just gonna have to let it go. Okay, so whenever things come up, you have to decide, is this a plan A problem, a plan B problem, or a plan C problem? But when you decide it's a plan B problem, that is something that is of high value, that is worth taking the time, then you engage in this. It first starts with empathy. And I think you've heard about empathy. Empathy is different than sympathy, is that you're making the person feel heard. You're open to new perspectives, and you listen and ask open-ended questions. And this is not just about saying, oh, I feel sorry for you. This is really listening and making the person feel heard. So in neuroscience terms, it's moving away from kind of the emotional brain to the cognitive brain. So when someone feels heard, when they're emotional and they're very upset with you, they're yelling at you and they don't want to listen, or they're in bed and don't want to get up, they're in their emotional brain, right, that limbic brain, that they're not going to listen to you, right? So you've got to take down those defenses. And you can do that by just figuring out what's going on for you. Are you upset because I've noticed that you're not doing this? Is it because you can take guesses and you ask them, is it okay if I ask? They're like, no, not right now. Then you come back to it. But when it's time, you break down that wall by first checking in with them. So you have to understand their perspective first. And I do this with my 4-year-old. You can do it with a 4-year-old. You can do it with a 9-year-old. It doesn't matter. This works for all people. Then you define your concerns. So my concern is, if this happens, then this, right? It's okay to share that. But you can't do that until you've heard the concerns of the other person. And the last step is the hardest step, is to brainstorm solutions. But they have to be realistic and they have to be meaningful, that you both agree on. So you can offer solutions. You don't dictate solutions. I wonder if there's a way we can find a solution. What do you think? Right? Here, there are solutions. Then you kind of find a middle ground. Okay, I know this sounds simple, but it takes years to work on this. And one of my other jobs is I work for MCFD, and I work with families in kids in care, in foster care, often Indigenous youth with developmental disabilities. And one of the primary things that we train caregivers in is this model of how do you debrief after a big upset, right? And this is how we build resilience in the people we support. All right. Navigating, this is the main title, but I'm fit in one slide, and I'm going to have to walk you through it. I know it's a bit overwhelming, but there's different types of mental health supports, and I have a PhD in mental health, and I still don't understand it all, and it all depends on where you're at too, right? So it's important to know the first level. So we're going to go down this pyramid in order. So starting at the top is the immediate help. So if someone you know is in crisis, then the first step is the crisis center for adults or the kids help phone. And so, for the first immediate step for if you're a caregiver is to just give them the phone number of the crisis line or kids help phone, so that they know that if they don't feel comfortable talking to you, but they're going through some big emotions, that they have someone to talk to. I used to work at the crisis center, and we're trained in just being open and reflective in our listening, and then directing to services. So even if you as a caregiver feel like you don't know what to do, you can call those lines and they'll direct you to a mobile mental health team that can actually go if there's a real mental health crisis, like suicidal ideation or actions, or they can coach you through what to do, or they can direct you to services. So that's the first line of defense I want to share with you all. And then there's just general mental health supports that can help you navigate, just learn more about the mental health services in your area, or just generally. So there's BC Mental Health and Substance Use Services that just gives you general education on mental health programs and services in BC. There's Anxiety Canada if you wanted kind of more self-directed mental health supports. They have an app for walking people through cognitive behavioral therapy if you want to do it on your own. There's Here to Help, which is a BC Ministry of Health website, and that'll give you all your local agencies. So there's Child Youth Mental Health. There's other mental health agencies that you can go to as drop-ins. So finding out what's in your area, and then just keeping that in your back pocket if you need to go visit a drop-in center. That's one way to access mental health supports. I know the IBD Center has some a list of mental health supports on their website. So yeah, there's the other government clinics like the CYMH I mentioned, that's Ministry of Children and Family Development. There's Foundry in some regions. That's like they have doctors, nurses, counselors, social workers, all in one, psychiatrists, all in one place. And then there's online peer supports. And I think this is an area that's untapped and kind of new in the last few years. There's lots of supports that are coming up. Crohn's and colitis, as Sarah mentioned, has the peer support program. There's Family Smart, which is actually for caregivers, for parents to talk to other caregivers who are having challenges with mental health, of kids with challenges in mental health. And there's Here to Talk for students in schools who want to talk to someone online. And then obviously you have in your school or universities, there's programs. If you get to the stage of, I'm really concerned, I do want a diagnosis, or I do want intervention and help, I listed the 4 different, so we call us mental health professionals, but there's different levels of mental health professionals. I think this is something that often people don't understand. What's the difference? So psychiatrists are medical doctors who have specialties in mental health, and their primary role would be medication. So they'd be complex medication changes. Your family doctor could do basic anxiety medication or depression medication, but you'd see a psychiatrist if it gets more complex and to make sure there's no interactions, concerns. There's psychologists through the BC Association of BC Psychological Association, who are regulated professionals, so registered psychologists is what you're looking for. And so they'd have a breadth of training to provide both diagnosis of mental health disorders or treatment. And so typically they're all doctoral level trained in mental health. And then social workers and clinical counselors are typically master's level trained, and they don't diagnose, but they can provide treatment and therapeutic support. Clinical counselors are currently not regulated by a college, but that may change soon, but social workers are. So all that means is that when someone is regulated by a college, it means that there's protection to the public if they do harm. So I would just caution when you find a counselor to just look at their training and background, because it's not standardized. And there's a large variety of counselors out there. Obviously excellent ones, but then some that may not have the appropriate training. Yeah, so just also to note that the word counselor is not a regulated term. So that means anyone can call themselves a counselor. I would just caution. But social worker, psychologists, and psychiatrists are regulated terms. So you can't call yourself that unless you have the appropriate training. Okay. Any questions on that? I mean, we're a small group. You can ask questions. All make sense? Good. Okay. All right. The last section is building resilience. So resilience, as I've talked about, is the ability to recover and adjust easily to misfortune or change. So there is some interesting research on resilience-based IBD care models. This is not my research, but an area of interest for me is, what's the difference between people who have high resilience and people with low resilience? People with high resilience are people who are able to bounce back after disease happens. Obviously, they'll still experience those lows, but they're able to bounce back. They have lower disease activity and a better quality of life, whereas people with low resilience are more likely to develop anxiety or depression and then have higher disease activity. So what does this mean? Well, there's interesting research from Laura Kiefer around a new way of looking at disease and intervention model from a psychological lens. And so the traditional view of looking at treatment is detect the vulnerabilities. So as I started, identify symptoms of anxiety and depression. So that we call mental illness as opposed to mental health. So we're looking at mental illness. And then we deliver evidence-based psychotherapies. That's not feasible and tangible for everyone. Acknowledge. Seeing a psychologist is $250 an hour. Seeing a counselor is $100 to $150 an hour. That's not maintainable for long term. So what are some other things we could look at? A new model of psychology is looking at strength-based treatments, early identification of strengths. So helping someone identify their strengths. If we could train, that's something I'm interested in, is how do we train doctors, counselors, psychologists, to start with the positives, identify strengths early. When you were diagnosed, did your family doctor, did your GI ask you about what strengths you have in your life? Or did they talk about all the stressors and bad things in your life? I have a great GI. I won't mention his name, but he's great. And his first question was, what's your next big milestone in your life? And I said, I'm getting married in a few months. He's like, we're going to get you there. And he was great. Building people's strengths. Were they compassionate? Did they provide you a sense of hope? He provided me hope for the future. And we know mindfulness is an important thing for you to start to be aware of your own body signals. And then we reinforce strengths that are already there. We foster adaptation, and we augment supports. So that's the new model of care. And there's 5 pillars to increasing resilience. I know it sounds simple, but this takes a lifetime to do. Is to first accept that you have the disease, and to be, when you're ready, comfortable to talk about it. Maintain the sun. Be happy. Maintain optimism and hope, right? Find things that are value and meaningful to you, and do those things, and surround yourself by people that bring that to you. Persist, tolerate distress. Distress is okay. And learn to do it yourself. And parents or caregivers, help them figure out themselves. It doesn't mean you pull back your supports, doesn't mean you go full in, but help them navigate that. We call that co-regulation. Help them co-regulate. Maintain social supports. I can't tell you that, I mentioned people I know, that these people are invaluable to help you work through this. So building that social network. One of the big things that has come out of research on social emotional learning for kids and what makes them the most resilient is that one adult that cares in a school. So if you have a child, the biggest predictor of success is not your cognitive level or your self-belief. It's just having one person in your life that cares about you and that you feel connected with. And so find that person. If you're the patient, if you're someone who experiences it, then find that someone. I've been lucky. I've always had mentors in my life, and it's something that I've always sought out, and people that I go to when I'm stuck, and they help you navigate it. So the more social support, I know it's easy to say, the more you have, the more resilient you'll be, because they're your support network. And I was not always confident. Talking in front of this room, man, a 19-year-old self would be just running out the door. But it takes practice and it takes time. So having that self-confidence and ability to make plans and take action, and as I mentioned, focusing on what you can control will really help you overcome those challenges. Okay. So I just want you to take a moment. You don't have to talk to anyone, but just reflect to yourself. Take a moment to think of one thing that you might commit to build your own resilience. So you might be able to take on the challenges ahead or support someone else through their challenges. One of the new therapies called third wave therapy is called acceptance and commitment therapy. Something that I practice is helping clients accept the challenges that they're facing and make committed actions towards what they're going to do based on what they value in their life, what their strengths are. And so if we can do that for ourselves, we're one step further along that path. Everyone got something? Committed to? I'm going to hold you to it. Okay. So that's my presentation. I thank you. That's my he's 4 years old now, but I think he was 2 then. A little COVID baby. That's my email, simon.lisaingo@ubc.ca. I'm not currently taking private clients, but if you have questions or resources or research ideas, as I mentioned, I'm just starting my academic career, so I have an interest in Crohn's and colitis, and and I mentioned to you, I've had these waves of interest, and because part of it, I have this separation where my professional life and personal life have been separate. And as I get older and wiser, I think, maybe, it's starting to melt together. And I'm happy and I'm fortunate to be invited to speak with you all today. I hope what I said, maybe there's a nugget of interest to you. But yeah, I hope we can together make a change and help people with mental health challenges. All right, thanks.